Hey everyone, welcome back. So today's topic is heavy, it's complicated, and it's a bit chilling. Actually, it's a lot chilling. So I'm going to be talking about the recent shooting of Brian Thompson, the CEO of United Health, which is one of the largest health insurance companies in the US, if not the world. So if you've been following this story, you know that this is a story that has ended up being tangled up with a lot of frustration for the healthcare system. And it's sparking a lot of discussion in online communities. So I wanted to talk about it. Here's a quick summary of what happened and what we know so far. On December 4th, 2024, Brian Thompson was shot and killed outside of a hotel in Manhattan in New York City. He was there for an investment conference for United Healthcare, and security footage shows as Thompson is about to walk into the hotel, the gunman comes out from behind a car behind Thompson and shot him in the back and the leg. And as Thompson tries to stumble away in the video footage, the attacker fixed what looked like a jammed gun and then kept shooting. Then the gunman casually runs across the street, hops on a bike, and disappears into Central Park. He's gone. Investigators don't know where he is, don't know who he is. They do have some photos of the suspected gunman from nearby, a Starbucks where he allegedly bought a protein bar and some water several minutes before the shooting, and then at a hostel where he allegedly was staying. He was wearing a ski mask and a hooded jacket. In some of the shots, he had the ski mask covering half of his face. And then in the photos at the hostel, you could see his full face. Investigators describe him as a white male with an average build. Here's the part that gets really chilling. So the bullet casings, they had words etched into them or words written on them. These words were deny, defend, and depose. These words reflect a tactic that insurance companies are often accused of to delay claims, to deny them, and then to defend themselves so they don't have to pay the claims. These words are also the title of a book that critiques how insurance companies handle claims. Basically, the book accuses insurance companies of denying care and dragging out processes to avoid payouts. So yeah, this crime was not random, it was targeted. But who exactly was this gunman? Why did they do it? Let's start with some obvious guesses. Maybe it was a disgruntled patient or a family member of someone who was denied life-saving care. That's possible. There are many people who have grievances against insurance companies for that very reason. Insurance companies and United Healthcare specifically have a pretty bad rap for denying claims. Just to give you an idea, United Health denied nearly a quarter of Medicare Advantage claims in recent years, and that rate doubled between 2020 and 2022. So imagine being in this desperate situation and having your care or a family member's care denied because it was deemed unnecessary by the insurance company despite medical professionals saying that it was necessary. So that type of thing breeds a lot of anger and resentment and rage. But what if this crime was not committed by a family member of a patient or a patient? What if this was someone from inside the system? Maybe a doctor or another healthcare professional. The words on the casings, the calculated nature of the attack, the planning, it doesn't feel like a rage-fueled moment. It feels methodical, almost like they were making a statement. If it was someone in the medical field, they would also know the frustrations firsthand, like fighting for prior authorizations with insurance companies, trying to save patients' lives while being blocked by people who've probably never seen a patient in a medical setting. So it's not far-fetched that this could be some sort of vigilante move by a medical professional, someone who is ideological in their beliefs and who says, if no one else is going to hold these people accountable, I will. The words being written out on the bullet casings that describe this deny, deflect, and depose, it it seems like something an insider within the medical system would be more familiar with, but and then also just the calculated nature of and the behavior of the shooter doesn't seem like it would be someone who was in the heat of the moment trying to get revenge for a family member. But it's certainly possible. And then also there are questions about whether this guy was a hitman hired to kill Thompson. He did seem to be familiar with how to use a gun. He was able to fix it when it was jammed. He was holding it the correct way. The hints that point away from him being a hitman are the fact that this guy walked into a Starbucks several minutes before the shooting and revealed his face on camera. Like, a skilled hitman would know not to do something like that. So was this about Brian Thompson specifically, or was he just a symbol of everything people hate about the medical system and the healthcare insurance system? Thompson specifically was caught up in a lawsuit alleging insider trading, where him and some other United Healthcare execs sold over 120 million in shares before a federal investigation for violating antitrust laws went public. Thompson specifically sold $15 million himself before that public news came out. So that is really suspicious and not reflective of high moral character. More likely, though, this is not just about one guy. I think it's about what he represented. So United Healthcare is not just any company, it's the largest health insurer in the US. It's been accused of denying claims, lobbying politicians, and spending millions to protect its interests. Since 1998, the company has dropped over $34 million on political contributions and $100 million on lobbying. So that kind of power makes people feel like they can't win against the system, no matter how hard they try. I've been scrolling through the comment sections of all of these articles and videos about this event, and the general public sentiment is not sympathy for Thompson. It's frustration with the healthcare system and insurance companies. So if you go look at the comment sections on articles and videos about the shooting, you'll see things like, am I supposed to feel bad asking for a friend who was denied coverage for a life-saving surgery? Or, well, that narrows the suspect pool to about 49 million people. This isn't just apathy, it's anger. People are fed up. They see CEOs like Thompson as part of the problem, profiting while patients suffer. And honestly, when you look at how broken the system is, it's not hard to understand why people feel this way. The US spends more on healthcare than any other country, but still patients are fighting tooth and nail for coverage, and doctors are battling insurance companies over what is medically necessary. It's exhausting and it's infuriating. So here's the thing, violence is never the answer. What happened to Brian Thompson is tragic, but the fact that so many people feel justified in their lack of empathy, that says something huge about where we're at as a society. People feel powerless. They've tried working within the system, laws, protests, books like that book I referred to earlier, but nothing seems to change. So when something like this happens, people don't feel bad. Some even feel vindicated, and that's the real tragedy here. A system that's supposed to help people is failing them so badly that something like this can happen, and instead of people having sympathy for the victim, it's actually creating a sense of vindication and justification. So this makes it even clearer, if it wasn't clear already, that the US healthcare system needs massive reform, specifically for all of the patients who need help. Let me know your thoughts. What needs to change in our system, and how do we change it to prevent something like this from happening again, and to create a better sentiment within the healthcare system? Drop your comments below. Let's talk about it.